Hello, my name is Natalia Valdivia, and this is my interview presentation. I interviewed Cassie Padilla. She's 25 years old. Her healthcare issues started when she was 13 years old when she suffered an ovarian torsion during school hours. She was rushed to the hospital that led her to the removal of her right ovary. Although throughout the years she has dealt with chronic pelvic pain in which has landed her in an emergency room for emergency surgeries 8 times. In the start of 2018, her health issues worsened. Her blood levels dramatically decreased due to her constant bleeding for 5 months straight. She was put in hormone treatments and did a lot of trial and error treatments. As time passed, she was nauseous almost every day and had high fevers, until in May 2018 she collapsed at work and was taken to the emergency room. In the middle of 2018, medical doctors made the tough decision to do a total hysterectomy. They were hesitant due to her young age. At the same time, doctors realized that her appendix was swelling due to her health issues, which was causing the high fevers. As a result, the medical doctors decided to do an appendectomy as well. More than 400,000 hysterectomies with or without ovarian preservation are done yearly in the United States. Her diagnoses were ovarian torsion, ovarian cyst. After doing a biopsy, they discovered benign dermoid cyst and the appendicitis. Although she is a young woman, she has had to deal with healthcare issues since the beginning of her teen years. Every other year, new problems arise, and or previous issues will reoccur. Support and intervention. How do you feel physically and emotionally regarding your health issues? Emotionally, it's affected me a lot, she stated. Although she says that she's physically fine, there are times that she notices getting tired often and overall feeling fatigued. She explained how some procedures she's been experiencing anxiety attacks and sometimes getting depressed. Some evidence suggests that financial stress may be associated with depressive symptoms. Do you have a support network, and how has the system of the support helped you cope? The first thing she said was, yes, you guys. She explained how her family and friends were her main support system. She was thankful that everyone she counted on was there to support her throughout the difficult times. How has the experience been as far as treatment by the medical establishment? She stated how sometimes it was difficult because they were going back and forth with her medical decisions. Aside from that, she mentioned that everything was very straightforward. She was aware of the situation she was in, and the doctors were very helpful and helped her understand all the procedures. Unlike back in the 70s when doctors gave women patients too little information and rarely consulted with their wishes before ordering hysterectomies and other drastic treatments. What obstacles did you face and how did you overcome them? She mentioned the main one was financial obstacles. Unfortunately, her medical expenses turned out to be much higher than she imagined. Although she budgeted, her insurance didn't want to pay for her procedures at first, but she sent in a letter and appealed, and they agreed to cover portions of the surgeries. In what ways, if any, have you noticed been treated differently by others? I feel like people are just cautious for me, she explained. How at work her coworkers tend to actively help her out since she works 13 to 14-hour shifts. They make sure that she gets breaks throughout the shift so she's not exhausted at the end. Has your race, ethnicity, gender, income, or age played a role in that treatment? She honestly doesn't think so. She mentioned an example of waiting with another patient that was also there for a surgical procedure with the same doctor. She mentioned that they were both treated the same and any information was given to both of them at the same time, and the doctor checked up on them periodically. If we lived in an ideal world, how do you think women in your condition would be treated? She believes that every patient would be taken care of and feel as they mattered. Another aspect is the financial expenses. In an ideal world, health issues like this wouldn't cost so much. In order to get help, nowadays you have no option but to budget, and most of the times that's not enough, she mentioned. In conclusion, the most important thing I've learned from this assignment is that we never know what kind of health problems people are going through. It is amazing to see the resilience women have and the obstacles they are able to overcome in their life. There needs to be more medical options to doing life changing procedures like a total hysterectomy, especially on patients of such a young age. Understanding health related quality of life trajectories should enhance counseling for women in deciding between hysterectomy and alternative interventions. Although I've always been interested in women's health, this interview and research I've done made my interest grow. There is so much research to be done in regarding women's health.